March is Colorectal Cancer Awareness Month, and we have put together a series of videos on topics related to colorectal cancer. I'm Dr. Radha Tamarisa, gastroenterologist in Houston, Texas. Currently, 69.7% of adults between the ages of 50 to 75 are being screened for colorectal cancer. Although this number has improved in the recent years, there is still a need for education and increased screening rates in order to impact colorectal cancer-related deaths. It is estimated that in 2022, 151,000 people will be diagnosed with colorectal cancer and 52,000 people will die from colorectal cancer. While the rates of colorectal cancer have been declining among adults age 50 and older, the incidence of colon cancer is increasing among adults under the age of 50. Young onset colorectal cancer is on the rise. 1 in 5 colorectal cancer patients are between the ages of 20 and 54. Based on this data, the new screening guidelines that took effect in 2021 recommend screening starting at the age of 45. African Americans in particular have the highest incidence and mortality rates related to colorectal cancer. From 2009 to 2013, colorectal cancer incidence rates were 20% higher for African Americans, and colorectal cancer-related deaths are 40% higher for African Americans. Talk to your doctor about colorectal cancer screening and protect yourself and your loved ones by getting screened for colorectal cancer.
A virtual colonoscopy or CT colonography is a method for screening for colon cancer and colon polyps. It is designed for average-risk patients greater than 45 years of age or those who are poor candidates for sedation during conventional colonoscopy. Essentially, a CT colonography is a CAT scan which utilizes special software to reconstruct the colon into 3D images, allowing a radiologist to evaluate all angles and folds of the colon, specifically looking for colon polyps, colon cancer, or any other abnormalities that may be identified. Advantages with this method include that it is fast, safe, painless, minimally invasive, and does not require any sedation. It is also equivalent to conventional colonoscopy in detecting colon polyps and cancer greater than 1 centimeter in size. I encourage you to speak with your gastroenterologist to discuss which screening method is right for you. As gastroenterologists, our ultimate goal is to screen the population by any method, as this is a preventable and treatable disease if caught early.
March is Colon Cancer Awareness Month, and we wanted you to know that the guidelines for colon cancer screening for average risk men and women has recently changed from age 50 to age 45. That means if you were born in the year 1977 or earlier, you're due for a colonoscopy this year. What are some other clues that you may be due for a colonoscopy? Well, if your idea of being social for the first half of your life meant mailing a letter, calling someone from your home phone, or meeting out in public face-to-face without looking down at your cell phone, you're probably due for a colonoscopy this year.
Hi, I'm Dr. Carrie Sorrell, a gastroenterologist from Lubbock, Texas, and I'm here to answer the question, what is a colon polyp? Well, a polyp is a growth that begins in the lining of the colon or rectum, also known as the large intestine. Some types of polyps, if left in place, can turn into colorectal cancer over time. During a colonoscopy, different devices and maneuvers are utilized to remove polyps and thus prevent this change.
Other than doing the colon cancer screening with non-invasive tests and invasive tests such as colonoscopy, is there anything in our day-to-day routine that can decrease the risk of colon cancer? There is. Diet is one of them. Diet rich in fruits, vegetables, and whole grains, and low in red meat and processed meat has been shown to decrease the risk of colon cancer. Second one is obesity. Obesity and overweight are independent risk factors for colon cancer in both men and women, but more so in men. So maintaining a healthy lifestyle by keeping the BMI less than 30 or 25 will help decrease the risk of colon cancer. Third one is aspirin. There are several studies that showed that aspirin a day can decrease the incidence of colon polyps and thus decrease the risk of colon cancer. But since taking a daily aspirin can carry certain side effects, please do discuss with your doctor whether taking an aspirin a day will be beneficial for you to decrease the risk of colon cancer.